I want to talk to you guys today about children on the autism spectrum disorder and autism itself. As you guys probably know, autism has become a huge major epidemic in today's society, with 1 out of 50 children being diagnosed with it. And the issue we have is that there's not much out there to help these children actually grow and get better from it and evolve from it. And it really breaks my heart when I see these kids come in and they're frustrated and they can't communicate properly and they have anger and aggression and striking. Okay, so there's usually different presentations of autism. We see that side where there's the anger, the aggression, the striking, because they're not able to communicate the way they feel. I also see a lot of subsymptoms of digestive issues that we all know are core and so important and need to be fixed, but chronic constipation, chronic diarrhea. And then the third set of things I see along with autism is chronic illness. So we see a lot of chronic ear infections since the child was born. We see a lot of chronic recurring colds, chest infections, swollen adenoids, swollen tonsils. So that's kind of what we see a lot of. So in that case, when there's other subset of symptoms, whether it's the anger, whether it's the swollen tonsils or the colds, or whether it's the other things, we tend to address those issues first, okay? So with the anger and aggression, we tend to deal with that first so the child is able to communicate better, able to express their feelings so they don't have to strike or bite or get aggressive, okay? So that's the first part. Once those things are addressed, then we actually move towards treating the autism itself, okay? And this focuses on allowing them to communicate better with us, allowing them to establish eye contact with people, allowing them to socialize better in social environments, because a lot of times these children cannot be in large groups because they get frustrated. So there's a lot of different presentations of autism. You know, we know the common presentations of autism, but there's a lot of individual presentations of autism that are different from patient to patient to patient. And with the homeopathic medicine, we find a specific medicine based on the individuality of that child presenting with autism, and we get this child better over a course of months. Now, what's super important is, and I want to stress, if you guys remember anything from this video, I want you to remember this. If you realize that your child started regressing from an adverse reaction from a vaccine, whether it was a week from a vaccine or a month from vaccines, but you notice all of a sudden they changed, they became aggressive, they became angry, irritable, or they develop some type of health issue after a vaccine, I encourage you guys, get in here as soon as you can, because there's an off branch of homeopathy called Isopathy or cease therapy, and we're able to almost antidote the ill effects of a vaccination if we know the specific vaccine that caused it. And we see miraculous things happen with isopathy or cease therapy. So that's another branch of homeopathy that we use a lot of with autism if necessary, and if you've come in quick enough after noticing an adverse effect from vaccines, okay? So that's just a little bit of an overview of how we do this at New Leaf Homeopathic Family Medicine. The other methods are detoxing by huge doses of vitamins. We do it with homeopathic medicine by stimulating the body to detox itself, okay, if it is of heavy metals or any type of other toxins. Or there's the food elimination. A lot of these kids, we eliminate all these foods, which helps us to a certain degree, but it only gets you so far, okay? So with homeopathy, we deal with the child's sensitivities to these foods that trigger their reactions, and we allow their body to handle these foods that should be harmless to them, so they don't have these excessive reactions to them, okay? So just a little bit of an overview. We have our autism program that if you're interested in getting a little bit more information about, give us a call and I'll explain the program to you. We'll learn a little bit more about you and about your child, and we'll go from there and get him or her better.